Hi,
Hi,
how are you?
good. How are you?
Good. So thank you for joining today. I'm excited to have you.
Excellent.
Um, so let's just get started. I just want to make sure that our connection's good. Can you hear me?
Yes.
Okay, great. I can hear you too, obviously. Okay, so I'll just start by a quick introduction and introduce you to. Um, so I'm Ginny Friedman. I currently work with Beauty Counter. I come from a long history in the beauty industry, mostly the non-clean side of beauty, but in the past 4 years, working in clean beauty. And really passionate about that and passionate about continuing my journey and learning about clean living and all of that. And just one second, can you hear feedback?
A little bit. I just turned my volume down.
Oh,
Yeah.
okay, great. So, you know, that's just a little bit about me and Dr. Corina Dunlap here. I'm honored to have you. And Dr. Dunlap is a naturopathic doctor. So she specializes in women's health. And I recently actually started seeing her as one of my doctors because I just was seeing a gap in really information and insight I was getting from my regular doctors. I love and respect my regular traditional doctors, so nothing wrong with that. But I felt like there was a gap in the care I was getting and the insight I was getting about my health and wellness. And so, what I love about this area of medicine and Dr. Dunlap is just she bridges that gap in the information. And specifically, I was about to turn 50. I really was one of the areas was hormones. And certainly my traditional doctors they weren't really testing, or if they were, they didn't truly have a depth of understanding around it. So rather than seek out another traditional doctor, I came to Dr. Dunlap for another number of reasons. So that um, quickly my connection, but why don't you tell us a little bit more about yourself, so we have your take on the area of medicine you practice in and a little bit more about you.
Yeah, definitely. And we're all specialists. Like I feel like the best situation is when you have people from various fields in medicine and you come together as a team, you bring them together as a team. So I have a deep respect for everybody's backgrounds and we all have our own focuses. Anyway, I am a naturopathic doctor and a researcher. So I got both degrees together. And then I went on to specialize in women's health, integrative women's health, and then also some gastroenterology. So postgraduately, I trained as a resident and as a fellow as a research fellow and as a resident in integrative women's health clinics. I work with endocrinologists, both reproductive and general endocrinology, from pediatrics all the way to adults. And then I worked in a menopause specific clinic for a while as well. And I also worked in a fertility clinic. So my really now practice seeing women at all stages of life. It's a secret, but I sometimes have some men in my practice. I'm trying to find a good man to like come in to take those men off, to do what I do. But basically, I love what I do. I look at everyone's care from a very systematic approach. I work with patients for a year at a time, and that's my research brain in action. So I want time points that we're checking in. I like to look at a really good broad spectrum of labs, but the ones that I really rely on the most that are as good as it gets. No lab is perfect, but I do use labs and run lab markers across time to look for patterns for people. And I'm very, very passionate about environmental medicine. I'm the vice president of the National Association of Environmental Medicine. We're a group of healthcare practitioners, doctors, and all sorts of different healthcare practitioners who come together as a community to provide information, get more information out there about environmental medicine. We have an ongoing stream of outreach to one another. Just had an arsenic case come through this morning about somebody's patient having arsenic in their urine. And I mean, it's ongoing. We're always chatting. I feel like I'm at the forefront of stuff by being on that board. It's great. And I can bring that to my patients. So
That's so amazing. Yeah. And I love for anyone who follows me or knows me knows I love research. So I love, like, hearing things that come from a research perspective. And I feel like, yeah, there's art and science to everything, but I just love that grounded approach that you have. So let's talk hormones.
Yes.
As I've mentioned, hormones is like an enormous topic, and we could sit here for days and talk about it. But clearly we just are going to skim the surface and maybe get some really good insight today. So I wanted to get that conversation going. So first, can you just explain, like, in layman's terms? I feel like we hear the word hormones a lot and we know, but just to refresh our memory or educate us, what is a hormone?
Yes. So a hormone is simply a chemical message that is sent from one gland to the next in the body. It's a chemical message with some information so that there's something to act upon. Like your brain, for example, we have the hypothalamus and the pituitary. Those are very, very important for the rest of our bodily systems. And those will send a signal to an organ that then needs to act. So we have a lot of hormones in the body. A lot of people, when they talk about hormones, think about sex hormones. We think about estrogen, progesterone, testosterone. But, of course, there's the thyroid hormones. There are satiety hormones. There's cortisol and as a hormone. There are a lot of different hormones. So we have adrenal hormones, we talk a lot about adrenal hormones, but and then blood sugar and insulin. Well, insulin is a hormone. So even sometimes we talk about vitamins, or people will think about vitamins, but there are certain vitamins that act as hormones. Like vitamin D is actually a hormone in the body. It's actually like a signal that gets sent from one organ to the next. So it's all based on that definition.
So fascinating. Yeah. And that's why we could talk for days or years about it.
Yeah.
So in your practice, I guess, what do you see most commonly? Like, what do most women come to you for as it's related to hormones?
Well, I think you really pinpointed it right away in this chat, just saying, like, you felt like there was a gap and there was something inside of you that just said, I could feel better. And I'm not necessarily saying that about you, but most women will come in and say, like, there's something I can do to feel better because I don't quite feel optimal. Maybe it's this like lingering fatigue, or the sleep isn't quite like what it should be, or it might be more than that. It might be like a lot of weight gain that doesn't seem to fall off easily, and it's just not normal for that person. Or they might be losing too much weight, or they're overly anxious that feels really outside of what is considered their norm, or they have a lot of GI stuff. And because I do focus on the gut and hormones, which is very much overlapping, they might have something going on with their GI, and they know that I'm gonna work on that with them. Sometimes it's libido, sometimes it's and then a lot of irregular periods, or missing periods, or fertility concerns, or, I see a lot of women in the perimenopausal years, which can happen early in our lifetime for some people. And people don't realize that, like, actually, I do see some women in their 20s and 30s. And, I've had even a few cases in the late teens that have had, for various reasons, no period, or were in early menopause.
Wow, that's incredible.
Yeah.
So, and I mean, just to build on that, how do you know if you're in perimenopause, since it's this big, vague, vast amount of time that I think a lot of people don't even understand?
Yeah. And it's really like, well, one signal is if you do get a regular period and it's not a withdrawal bleed from like a birth control method, your period might be off. Sometimes it's other things though. Maybe the period is elongated or just irregular. And then there are other symptoms that come along. Like people think about hot flashes and night sweats, but it might be increasing mood irregularities like irritation, anxiety, worsening depression, dryness, and various mucosal membranes of the body, including vaginal dryness. It can be, so much changes to the hair, weight changes, so those are just some of the signals, but those can happen without menopause happening, right? But if you suspect that you might be wondering if you are in those years or perimenopause is creeping up, then you can ask for a blood test. And it's not a perfect blood test, but you can ask for a blood test from your doctor. And there are other types of tests too, urine tests as well. But, the main kind of go-to test is a blood test, and your doctor will look at a hormone known as FSH from the brain. And sometimes also doctors can run AMH, which is not a standard of care way of looking at it. But, sometimes I'll look at that too as more of an egg reserve test.
Got it. And would you say that it's important to understand like what it is a normal process that your body goes through, right? So to what extent is it important to know that you're actually in perimenopause, and, why would someone want to know or seek that out?
Well, I think it's really empowering for people to know that, they're not, I don't like to even use this word, but they're not kind of losing their mind, that's not something, it's something that is part of a natural process, especially if it is of the average age. Like average age menopause can be actually finishing your period is around 51.4, but people can start having those changes in their early 40s. And it is part of a normal process. However, there are many, many ways to help ease those symptoms and make people feel the best they absolutely can feel during those years. You don't have to just deal with it. There's so many ways to go through it gracefully. I mean, these are often, if it is of those standard years, those standard age range, there's so many ways to just have those years be super amazing and vibrant. And I mean, I just, I try to surround myself by women who are just taking it on like, this is such a great, empowering time. And I try to empower women to feel that way too. And I've just seen beautiful things from that. But in the earlier years, if it's happening earlier than we would expect, it's really important. It's empowering. Like you want to know what you can do about it. You want to also be able to protect yourself, because if those years are coming early, there are lots of ways to protect your all of the tissues of the body, the bones, the brain, the skin, hair, skin, and nails, like the arteries. And so many things. There are ways to protect you. So it's a really important conversation to have if you suspect. So having signals, like I was mentioning, having those signals from your body, you want to listen to your body. I mean, obviously it's not to be like more on the kind of over worrying side, but just like, oh, something's off. Trust yourself, because every time women trust themselves on something being off in their body, even if their doctor dismisses them, you go find another doctor, because the likelihood that your body best, that is, that you're probably right on. Like that, I just listen to your body. I have to listen to my patients' bodies, and what they tell me.
I love that. And I mean, being someone who's recently gone through my late 40s, I feel like I said, I love my doctors, but there's a lot of answers that just come, which is like, yeah, well, you're that age. So I think, for whatever reason that is, we won't get into that here, but, just not accepting you're just that age I think it's just so important to know there are options out there to get more insight. And like you said, to really live a more vibrant life where you actually feel good and feel your best, because there may be more reasons to it. So I love that. Okay. So, so much to get through, and so many interesting nuggets here. But you mentioned gut health, you mentioned it really quickly. That's another hot topic. And hot topic not meaning fat. I think there's, so much research that's happening there, and so much more that we're learning. But can you speak a little bit to the connection of gut health to hormone health? What are the big areas there?
Yes. And definitely, if you are interested in this topic, I just drew up a whole bunch of posts, or drafted a whole bunch of posts that I'm going to put on Instagram these next few weeks on gut health and how that influences hormonal health. So this is a big topic that I talk to my patients all the time about. So basically, when we think about those sex hormones, like I was mentioning, estrogen, progesterone, testosterone, just those alone. If we have a disrupted gut microbiome, it can influence how well we, number one, detox those hormones, because the gut impacts like, it's the downstream area of the liver too. And we know that the liver really processes a lot of those hormones. We know that in cases of conditions like endometriosis, in conditions like fibroids, we know that conditions like PCOS, the gut has a major role in how those conditions play out. We know that from animal studies, for example, that women with PCOS, we can do a fecal microbiota transplant, which is where we change the microbiome or change the fecal matter, somewhat transplant it. And we can see those PCOS parameters in the labs reverse and to where it looks like there's no PCOS at all, and for cycles to regulate. So there's a big influence, and I see this more and more. I talk about it more and more. I'm diving into the research more and more. I'm going to do a whole lecture to my colleagues in the fall on the way that the gut and the microbiome influence these common women's health conditions. So stay tuned, because I'll have a lot more information I'll be posting on that.
That's incredible. And I know there's also a lot going on with gut brain too, in terms of like anxiety and all of that too, right?
Exactly. Oh yeah. So I mean, there's a super highway from our gut to our brain. And unless we work on both, like you have to work on both at the same time. And then the one that doesn't get talked about enough is, two that don't get talked about enough is how our cortisol is regulated from our GI. That's a huge one. So our stress and our GI have a major overlap. So the microbiome and how they cross communicate with our bodies can really influence how the stress impacts our bodies and our life. And then also the thyroid. We know that when there's low thyroid hormone, so in cases of hypothyroidism, that can lead to more inflamed tissue in the GI, and that can lead to thinning of the tissue. So for example, when people have ulcers in their upper GI, we can sample that tissue and see less thyroid hormone there. We know that like a leaky gut or inflamed gut can also influence the thyroid to become less, to convert less to its active forms of thyroid hormone that the body can use. So it's really fascinating. And then, like I said, that cortisol or the stress hormones can be influenced by how the gut is functioning.
That's amazing. And so we'll get back to that a little bit, but as we talk about, hormones, and probably why a lot of people go to see you, a lot of times it's, to see if their hormones are balanced. We hear that a lot. Hormone balance, hormone imbalance. And then there's also the big topic of hormone disruption, which I talk a lot about because I'm in the area of beauty and really being aware of ingredients that cause or don't cause hormone disruption. So can you tell us, what is the difference? Just explain a little bit more about hormone disruption, hormone imbalance. What's the difference? And I mean, the other thing too is like, since is hormone disruption real? Just a little bit on that.
So hormone disrupting chemicals, there are very, very real. It's a very, very real conversation that's becoming more and more a hot topic. And so they are EDCs, or hormone disrupting chemicals, that are in our everyday environment. I think about the main exposures being for our water, our air, our what we put on our skin, so what we apply topically, and through our food. These are endocrine disrupting chemicals. Hormone disrupting chemicals are things that mimic our hormones or disrupt the way that our hormones communicate and are binding to those other organs in the body. And we might often think about things like, we can think about, estrogen disrupting chemicals. We know, for example, that
I can't hear
a lot
you.
of people have been doing research on, how, like, for example, I mentioned endometriosis, or can you hear me okay?
I can't hear you.
Can you hear me now?
Can everyone else? Oh, wait.
Can you hear me now?
I can hear you. Yeah. Okay.
I had a call come through. I think that's what happened.
Yeah.
Anyway, I'll back up a little bit, but basically endocrine disrupting chemicals are real things. Hormone disrupting chemicals, we can get exposed one of four ways. And they can it can influence the way the period is experienced. It can cause we can have more PMS or PMDD. Uterine fibroids are more common when people are exposed to more of those endocrine disrupting chemicals, more fertility issues, more bleeding irregularities, like I mentioned, a thyroid disruption, gut health disruption, more mood concerns, mood complaints, more cancers. So it's a big topic. There's a researcher that I studied under who is out of France, who talks about them as being also nervous system disruptors. So there's like hormone and nervous system disruptors, which I think is really a good re-terming of it.
Yeah, definitely. That's fascinating. And so, and the 4 areas you said, just to recap, are, just recap what those are again.
Food, water, air, and what we put on our skin.
Got it. Okay. So I think it's important just to underline, there's so much that in our environment we can get crazy with in terms of understanding, like it becomes overwhelming. So I think that, part of the key is not to become overwhelmed, and just, those are great topics to look at. And, just finding out, like, where can I start to, if you're, some people are far down the path in terms of trying to control what they can control. Others are just learning about things right now. And so I always recommend just looking, talk to someone who might be more aware so that they could help break it down for you. Where would you start? Just take one step at a time. I've been working on this for myself personally for at least a decade.
Me too.
And I still have a ton left to go in terms of things that I know I could be controlling and doing better at, but I'm not. And so I think part of it is, as far as I'm concerned, is do what you can to control things one step at a time. It can cost you a lot of money to just go at it all at once. It also can make you crazy. So one step at a time, where it makes sense, as your budget permits, as you run out of things and want to replace things, maybe in your household, to really just know that you're taking things one step at a time, and making things, controlling what you can little by little. And I think giving yourself a pat on the back for doing that too, along the way.
It can be very anxiety provoking for people to even start going down the path. You're right. And so like, I try to reassure people, remember, your body is also extremely resilient. It doesn't mean we disregard the information if it's overwhelming, but also little by little, it does make a difference. People's health does really improve the more we pay attention, but you really have to like monitor how you're experiencing that, engagement with the information, I guess. And so, you just, maybe starting with like an inventory of the things that you're using, or what your environment is like, and you kind of keep notes. You can keep notes, but as you run out of things, what would be a different brand to use, for example, for your laundry detergent or your cleaning products or your makeups or your skin products, or like, what is the air around you like? How could that be better? What are the choices you're making at the store, and, when you're getting your food, and how much you eat out, and what kind of things are being used. So, it just takes time.
Definitely. Yeah, that's great. And then in terms of, hormone imbalance or disruption, like, what would you say, what are some key recommendations that you make? Or I know it would vary and it's very individual, but are there some general broad buckets of recommendations that you make when it comes to, guiding your patients?
Yeah. So I'm because I do start everybody's healthcare plan with looking at their gut. I'm always focused on, I'm really focused on food, and then I usually talk to them about water too. So like, where do you live? Let's figure out what your water is like. Are you using filters? What kind of food are you buying at the store? Are you getting a variety of different foods? A lot of foods that are really colorful, like our veggies and our plant fibers, are very protective of the body, but we definitely want to be thinking like, are we buying organic food or not? And the more we learn about this, and you'll start seeing the term forever chemicals in in the media and stuff more and more these days, but the more we look at, the more it's like, yes, you know, it is worth it buying organic as much as you can. It's not always possible for everything, but really being conscious and aware, if as much as the budget allows, like to make those choices. And you can certainly follow the dirty dozen to choose those at least. But making conscious choices around the food and then what you eat and when you eat it. And then the more diversity in the diet, the more our bodies can protect us from some of the chemicals. For example, that researcher in France, Dr. Seralini, talked about how like aromatic herbs, eating the aromatic herbs can help you detox your body from glyphosate, for example. So like you can eat more variety in a diet and protect your body and make your body more resilient to some of these chemicals. That being said, if you have like major metals in your water, you want to know that. And if you're on well water, or if you're on city water that's quite harsh, we want to know that. So having your water tested, or at least, looking to see in a local area who does water testing, and at least getting those metals tested is a great idea. You can also search environmental working group, put in your zip code, and find out what your water supply has in it in terms of the chemicals, and what kind of. They also give another tool there too, where they recommend like what kind of water filter would be good to use. So I love that tool.
That's amazing. I love that, because it can be very confusing to figure out. I mean, I've started on that, like, well, how do I know what tests or where? So that's really helpful. Yeah. Okay. In terms of times of life, I mean, hormones, like I said, our bodies are changing as life goes on. Are there particular times of life that your body would be more vulnerable to this disruption or hormone disruption, or more times where we should pay extra attention to how we're caring for ourselves as it relates to our hormones?
I always think about like these more vulnerable situations or populations or time when we want to, be very careful. Well, of course, our growing kiddos, right? Like our newborns and our growing kiddos, and using the cleanest products possible on their skin. When you start introducing foods, if you can use whole foods and good variety of foods, following your doctor's advice with like how to introduce things, but making sure they get lots of protective, colorful foods that are organic if possible. And then those early years are just so critical. So like everything that I put on my baby's skin, when I have my little girls, like they're a little bit older now, but even now, I try to teach them, like, if you're going to use a face wash, let's talk about what it has in it, and let's talk about what you're using. It makes a big difference. So I do use the environmental working groups database a lot. There's a new company called millionmarker.com. They're doing home testing for toxic, chemicals in the body, which is really cool. And they're trying to get a lot of information out there. They have like some cleaner products that they recommend, including some beauty counter products, which is cool. But anyway, I love that company. I'm starting to really pay attention to them. And then there are a few other good websites, but I've been using Environmental Working Group for a long time. So I focus on the young ones. I focus on puberty. Like that's a big time when kids really start to see the impact of not too clean of a diet. They start to see like the stuff they're putting in their body really make a difference to their skin, to the way they're experiencing all those hormonal shifts. So that's a big time to really hone in. The next time to really hone in is like at least a year before you want to conceive, at least. I mean, I always like to think of everybody in preconception mode, who, if they want to have children one day, like they're in preconception mode. But if you have at least a year for women, at least a 6 month period for men, it's really critical to help clean things up. And then that helps you be ready to then have kiddos not only are they more resilient when they're born, hopefully, but then you're going to have healthier habits for them and be ready to go with like cleaner air and cleaner water and, those products, and you'll be thinking about it more. So, and then of course, I think about like these, later 30s, early 40s, and then menopausal years, like that's critical too, because so much can come in the way of our endocrine disruption there, as we want to keep our bones, our skin, our, arteries, our brains healthy. That's a huge topic area. So it's all of life, I guess.
Basically, yeah.
Some of the key moments.
No, it makes sense. Right. And I spoke with an endocrinologist, and she mentioned like, one way to think about it too is a time when your cells are multiplying a lot. So when you're having a baby, when your child or baby is growing, obviously puberty. So, and the other thing that always struck me was that some of these chemicals can pass that you're exposed to can pass through your body into the placenta. So, and then impact the genetics. So it's like, there's a term called epigenetic, which means it, you can pass down some of your exposures through the generations, which is incredible. And some chemicals flush out of your system quite easily, is my understanding, but others really stick around a little bit more. So I think just underscores that importance of controlling what you can in terms of being clean.
Exactly. Yeah. So yeah, exactly. Pregnancy is huge time, but preconception, I do preconception. I'm not, and then I usually step back during the pregnancy because I'm not a midwife or an OB, but yeah, I mean, that pregnancy time is critical. Yeah.
Great. Okay. So in terms of, just want to be mindful of time here, but just wanted to jump onto skincare because that's my area of expertise and my passion. So when you think about skincare, so you mentioned you look at environmental working group, I look at that too. There are different ways. Is that your kind of catch-all filter, or are there other things that you look at in terms of deciding what skincare or personal care products to use or not use?
I always look at the ingredients label, and often if the product as a whole doesn't come up in a database like environmental working group, I'll look at the individual chemicals and I'll type them in. So I'm really particular about that. Like I'll just see like, what's the score? You get a score from 1 to 10, 10 being the most toxic, and you want to be at like a 2 or below, or a 3 or below at least. And then, you do your best. Like there's no perfect here. We're all exposed to chemicals. There is no perfect. So perfect is not, it's not impossible. Honestly, it's like, the most knowledgeable people get exposed to stuff. So you do the best you can. And there are great ways to do it. So I do use that database. I've been asking for some certificate, like with my supplement lines and stuff. I've been asking for a certificate of analyses right now, because I want to know, are there any molds? Have they been testing for metals? Make sure they're staying on top of their sourcing and their third-party testing. And that's really important. So like things like people don't think about, they're thinking about their food, but they might not be thinking about like their protein powders or their, the other stuff they're putting in their bodies. So, that's the stuff that I'm diving into more and more these days. And we're doing that as a group. It's in the National Association of Environmental Medicine. We're starting to do more of those quality checks on our end.
That's great. Yeah, I think that's so important too, because I'm sure food and vitamins, supplements, same with beauty, there's such a long supply chain and it's complex. And so, a manufacturer could say or something on their label and make all these assurances, but they actually don't even always know. They haven't always done their homework and even know all of the info and the practices that are going on with their suppliers down the supply chain. So, and then even the ways that they test, like modes of testing, right? Like you can test, but if you're not testing it with a fine measurement, or I forget the word I'm looking for, but if you're not testing for small levels of contamination, for example, you're only testing for large levels, you're only going to find out if there's large levels and not small levels. Those will get through the system. So understanding, what those manufacturers do in their practices is helpful. I mean, a regular everyday person isn't going to necessarily understand that. So I appreciate you for having that information. And, working with Beauty Counter, I know what they do and how they stand up compared to a lot of other manufacturers. So I can assure people on that level, on top of, sources, third-party sources like Environmental Working Group, which just another easy check to go down and look and say like, okay, they've done the homework for me. The other thing I do just is, there's just some big ingredients that I see prevalent in skincare and personal care. And one is fragrance.
Oh yeah.
So phthalates and fragrance, a lot of manufacturers will say no phthalates. Phthalates are a big class of endocrine disruptors, but artificial fragrance, which shows up on the label as fragrance or perfume, PARFUM, often hide lots of ingredients, like hundreds or thousands of ingredients, which often can be endocrine disruptors. And because the fragrance houses that develop these fragrances are often keeping their fragrance profiles proprietary. Manufacturers may not even know what's in them. So that's one of the key things I always look on the labels is fragrance.
Definitely.
And I just try to avoid products. My girls, I know I make my daughters crazy with that because I'm always like, let me check this body scrub that you want. So they're learning, but it's amazing how many manufacturers still use that. I suspect it's going to change over time, but it's a big one for me.
Yeah, me too. Agreed.
Yeah. Okay, great. Well, I want to just, wrap this up a little bit in terms of some of the questions that have come in. Someone asked I saw a question come in around constipation help. Is there anything that you recommend about constipation help? I mean, that's very specific, but don't know. I guess that's related to gut health.
Yeah, such a big topic. I have a whole post coming out. It's just like very, it's very multi-layered. So yeah, constipation. The first thing just to say is you don't want to live with that. So like, this is one of our huge emunctories or our eliminatory pathways, how we get out what the body doesn't want in it. It's the urine, and we think of first urine and the fecal matter. And we also sweat, respiration. Then there's like a whole spiritual, like more emotional side of things, but it just is really important to keep the stools moving. So it's good that they're asking the question, and just pay attention to my Instagram because I'll be talking about that a lot soon.
Amazing. I love your Instagram. It's so helpful. Okay. So the other question was postpartum hormone balance. I mean, you did say you tend to, not necessarily dive into pregnancy, leave that to other experts, but anything to add about postpartum hormone balancing?
Yeah, postpartum is a time when you're naturally not going to be in the same kind of balance that you were. I mean, if you're breastfeeding, there's the higher prolactin. That higher prolactin can somewhat suppress ovulation. Your body's not necessarily having those the ovulatory cycles. Even sometimes you might be, even if you're not having a period, but it can be very inconsistent. Oftentimes there's a higher demand on the thyroid. So it's a different time for hormone balance. So, keeping in mind that this is a different time for you, and that eventually what you will come into a new sense of normal for you but it's a transition time. It's a big transition time, and your body's detoxing a lot from the pregnancy. Just being kind, and just remembering that it's a big transition time. And with any transition, recruit some good support systems. I do a lot of postpartum care, recruit some good support systems, make sure you're using things that are safe for you if you are breastfeeding, for you and baby. And then just remember that like, it's a lot of basic care stuff too. Like keep yourself hydrated, keep yourself making sure to eat, sleep when you can. It's a big time, but, and yeah, just don't forget to reach out to people who want to help.
Absolutely. Okay. And one more question that came in was safer nail products going to a nail salon. Are there other products? I mean, I know there are a couple, so it's a good question. Someone who, since I had been diagnosed with breast cancer and wants to just be careful. I mean, I want to be careful about the nail products I use too. I would say, look at, there's a lot of labeling, like companies that come out with free, like they use like 7 free, 10 free. I just go for the highest number of free as part of it. But a few brands that I know, like Orly Breathable, I think is 13 free in terms of their ingredients. Cote, C-O-T-E, is a brand that is founded to be clean. So, I mean, clean within reason, like these are not perfectly clean because they are nail polishes still. And then another one is Dazzle Dry, that also, that that's out there. And it's in some salons, but you can also buy these and bring them to salons. I don't know if you have anything to add on that.
Yeah, I know. Sometimes I like to treat myself to something like that. And, I'm like, you're still want to do things like use makeup or like whatever it is. And I try to use exactly. I have the same technique you do, and I'll look it up and and then I'll like decide which salon I'll go to, if they'll use something I bring in, or if I'm using one of their products and what it is. But the marketing always gets people confused, because marketing is marketing. Marketing is meant to make, encourage you to buy it. So you go and do your own research as much as you can.
Definitely.
Yeah.
Great. Well, I think that's it. Again, we can talk forever. But thank you so much for joining. I really appreciate this. I thought it was so fascinating. I'm always learning from you. And so everyone, go follow Dr. Dunlap, Dr. Corina Dunlap. Her Instagram is full of information, and I'm always learning. And then you can also follow me too on Project Clean Beauty, where I'm focusing more on the beauty side and trying to educate there too. So thank you. And please, if you all have questions, please reach out to me. I do pay attention to my messages. I love getting questions and follow-up, or if you need help with attacking that, clean side of beauty, then I'm here to help you for that too. So, and Dr. Dunlap, I know you practice you're in Maine, but you practice in a number of states, right?
Mm-hmm. Yeah. So I practice in California, Oregon, Maine, and New Hampshire. And I do work very much with patients who want that long-term relationship. So I work on long-term care. It's what I find to be the most fulfilling, because I get to know people and I can help the best that way. And then the rest of what I'm doing is education, to the general public. So it's just the balance I have. But yeah, I do book out a little bit now in advance, but it's, if you are looking for a long-term relationship, then it's worth the patience for that. But if you're in one of those states, please, and you're serious about a longer term relationship, I'd be happy to chat with you. And I do a 15-minute call to get to know you a bit more.
Great. All right. Well, thanks again. So nice to see you. And thank you everyone for joining.
Thank you for having me. It was such a pleasure to be here.
Okay. Take care.
You too. Bye.
Bye.